This is Dr. Rekha Gogi. I'm a practicing obstetrician gynecologist, Malleshwaram, Bangalore. Greetings from Cloudnine Hospital, Malleshwaram, Bangalore. Today I'm going to be addressing methods of contraception available. This is also one of the commonest questions asked or suggestions asked by young couples for contraception. Contraception means preventing an unwanted or an unintended pregnancy. What are the commonest methods and why would people want contraception? Various reasons. What are the top 5 contraceptive methods available for couples today? Let's go one by one. First method, though it's not easy, it's the best and the safest, which is abstinence. If you don't want to get pregnant, don't be sexually active. Many people would laugh at what I say, but it is a good advice, though many people don't follow it. That's why we have so many unwanted pregnancies. Second one, commonly used, condoms or the barrier contraceptive. Condoms act as a dual method of contraceptive because they not only promote birth control, they also prevent sexually transmitted diseases. This is commonly used for women who are not yet in a committed or a long relationship, multiple sexual partners, and for people who have sexual intercourse or sexual encounters very infrequently. Condom also is not a great contraceptive that way because it has a high failure rate. Condom works best, or the barrier method works best, if it is used with along a vaginal spermicidal jelly. This causes a lot of preparations that when the male partner uses a condom, you have to time the sexual intercourse, you have to time the insertion of the vaginal jelly. It's a messy thing. It can cause burning, it can cause irritation and itch to both the partners. Hence, not very frequently and very commonly advised, though it is commonly used. Let's go to the third one. Third one is what is called as an intrauterine copper device or IUCD. This is the most commonly used intrauterine device in India. It is a mechanical device. It is placed in the cavity of the uterus. It's an office procedure, does not require any anesthesia. It is over the whole procedure of insertion is less than 5 to 7 minutes with an experienced doctor. You see, it is easy to insert and it is very easy to remove also. It's also one of the most widely used methods in across India and rural India because it just takes one commitment from the patient and the doctor. This copper device can stay inside and work as a contraceptive for as long as 5 to 10 years. Copper device can also be inserted by midwives and nurses who are trained as soon as the delivery of the placenta. So it is called PPIUCD. It is very, very economical to use. It is easy to insert and easy to remove and hence makes it one of the best. Copper IUD is used mostly for spacing between two children. I would not recommend a copper IUD for somebody who has not yet been pregnant or not yet had a delivery. Now, what else can copper IUD bring to you? It can cause a little heavy menstruation, painful menstruation, cramping, and vaginal infections. Sometimes it can be misplaced, it can be displaced, and it can fall off and the patient does not even know. There is a thread which is attached to the copper T which hangs out of the mouth of the uterus. That is the best method to see whether the copper is inside or not. You might have to go to the doctor once in a year or 8 months to make sure that the copper device is inside. Now the next method is also a device which is intrauterine, but instead of copper there is a barrier which there is a barrel of a hormone called as progestogen. This is called as a levonorgestrel intrauterine system. This is an expensive device, but it's a hormonal device. This is more for people who have already had heavy menstrual bleeding, who have already delivered, who are a little older in age, who don't mind not having a heavy flow. So why am I saying this is because a hormone in the uterus which is placed as a intrauterine device can make the endometrium completely bald and hence there is not much to bleed. In India, because of so much of social reasons, many women are not comfortable with not having a period. So I would recommend this intrauterine device which is a IUS system, which is a hormone device for an older woman who's not bothered too much about having a period monthly, because you are not going to bleed heavily like you would otherwise. But the advantage of having an hormonal IUD is that it also prevents from having endometrial cancer. It is reversible. Even though it's expensive, it can work both as a device which will help in controlling excessive bleeding and also a contraceptive. Also, it does not disturb your ovulation or anything to do with your ovaries. It is again very easy to insert and very easy to remove. It has the same problems or complications or comfort which a copper device would offer you. What is the last one? It is called as a commonly birth control pill, which is a combined oral contraceptive pill. Combined oral contraceptive pills are one of the oldest molecules available, which revolutionized sexual health and health generally of women who were able to choose when they want to have a baby. Because oral contraceptive pills are pills which are taken by the woman as long as she wants to take it, under the guidance of a doctor. There are many preparations and formulations of these oral contraceptive pills. The latest ones are available, which are so small in terms of hormonal side effects that it is very well accepted by most women, and they are the best because they have the least amount of negative or adverse effect. However, while you are on oral contraceptive pills, you have to make sure that you visit your doctor, get a prescription, make sure that the doctor has checked your blood pressure, she has done your lab tests, she has made sure she's noted down the history before she offers you an appropriate hormone preparation for you. Talk to your doctor before you take a call about what contraceptive to use. Thank you.